So we were talking about steroids earlier. I personally have been putting the 1% hydrocortisone on my son's eyelids when needed, because that's where he has it worse, his knee pits and his eyelids. But I am nervous that that's not a safe application to put on eyes. So what is safe, what isn't?
Yeah. So there's lots of discussion around safety with topical steroids at the moment. So topical steroids are safe and effective when we teach you how to use them properly, which what I've talked about in the previous one, lower strength that's effective early into a flare and making sure that we've got we're putting them on the right areas. So as we alluded to with the different strengths, we don't want to use a strong steroid on areas that are fragile. So your eyelids especially are really thin skin, and your face and neck, groin and armpits are areas that we treat with caution. So when it comes to those areas, we tend to use our more mild category steroids, so like our hydrocortisone. You can use steroids to your eyelids. Really important that if there's inflammation, that we're putting any inflammation out. So hydrocortisone is a great place to start. I personally, in my prescribing, generally get it made up as an ointment when it comes to eyelids, because it's helpful at clearing it, but it doesn't come in an ointment tube in New Zealand. That has to be made up. But definitely you can use hydrocortisone to your eyelids. Just caution with not getting it into the eye, because there is risk of glaucoma if we're getting it in the eye. But when it comes to eyelid eczema, really helpful to do preventative measures. So Vaseline to your eyelids frequently as a barrier. So again, thinking of that brick wall, putting a nice barrier on it to protect, because children, if they're tired, tend to have a rub, and that can aggravate the area more. So putting Vaseline around the eye.
Would pawpaw cream work as well?
Pawpaw is a food. So like we talked about, so same kind of concept, So the ointment feel of the pawpaw is great, because we want it, that's what that feels like. So, but we want to do it without the food. So things like Vaseline are really helpful, soft white paraffin, that kind of stuff, to put a nice layer to protect. But then, you can use hydrocortisone to that area, and we use a lower strength to those areas, those vulnerable areas. Sometimes we need to use stronger. There are also medications that we can prescribe that are non-steroidal ointments and creams, which we can apply if we're getting prolonged eyelid eczema and we're unable to get it controlled with topical steroids. We've got a different class of medications that come in ointments that we can use, and your GP can prescribe those as well.
Okay. Anything else around safety of steroids that we need to know?
So we want to make sure, so in terms of, I said they're safe and effective if we teach you how to use them properly. So what we don't want is to use steroids for a really long time daily. That's never our aim when we're prescribing them. So that's really important to reinforce. If you are using a steroid and it's not making your flares go away, that inflammation, like I said, something's not right in the management. Or we do have a subset of really severe children or adults with severe eczema that topical steroids aren't going to be enough. And if that's the case, then often we start looking at things like systemic therapy, so tablet therapy for people with really severe eczema. So we don't really want to recommend widespread long-term use of steroids. We should be using them in short, sharp bursts and doing the tapering like we talked about, or we should be seeing resolution within 2 weeks. Definitely, if you're using it daily for weeks to months on end, then that's not great practice. Something in the management isn't quite right. So it's important to keep an eye on that. And when we do use it daily for a really long time without any breaks, that's where we can start to see some of the side effects.
Can you tell us about those side effects that we would see?
I
was thinking perhaps the body gets used to it and it doesn't respond anymore, but are there other side effects that could be worse?
So one of the side effects I hear that people worry about a lot are skin thinning. So in regards to that, yes, skin thinning or skin atrophy can be a side effect of steroids, which is why, as I said, when we use them, we want to make sure that we're using lower strengths on our vulnerable areas. So we use our lower strengths on our eyelids and our faces and stuff like that. And so when we're using it to the actual areas of eczema, the risk of skin thinning isn't high. So we don't often see it because the eczema itself is raised in what we call lichenified, so that thickening of the skin.